So the first thing that we're going to do is we're going to do the squat neuromuscular retraining. Okay, so the slide here is showing you how we go through that. This demonstration that we're going to do right now is going to show you how we go through that. So again, we just went through the squat neuromuscular retraining where we put our athlete through a series of squats. We gave them perturbation through their entire core as well as their hips. One of the exercises, one of the things that we've talked about is that you should be able to correct a lateral shift in as little as 3 visits. The way that you will know that if an athlete is doing what you've asked them to do is whether or not that has been corrected. Outside of if the athlete is doing the correctives and they are doing them at home, and if that is not corrected, what we need to do is we need to go back and really assess that lower kinetic chain again and see if there is some kind of bony block or something that we missed on our differential diagnosis. So one of the exercises that we use for the home exercise program for the squat neuromuscular retraining, again, uses the CLX band. So the band has multiple loops to it. What I've done is I've stepped in the middle of the band and I've put each foot into the CLX. That way I've got both ends of my CLX. What I'm going to do is I'm going to cross this across the back so it's like that. So that I'm bringing a cross-link system into play, which is going to help with my core stabilization. Again, what I want to do is I want to make sure that that X is above my rear end so that it doesn't prohibit me from going through the full motion. Then in this position, what I can do is I can do multiple exercises at home, which is going to again drive improvement in that lateral shift. So I can start with just a normal squat. So I'm having the athlete do a squat with a push. Why do we do that push? Remember what we said with the hands clasped together? When we bring in that pec contraction on top of that core contraction, we actually get more of a core contraction. In addition, by using the band, I'm also getting a lot of scapular stabilization with that. I'm really bringing in not only the posterior chain, but also the anterior chain with that. So I can do that in several different ways. I can have them do a squat push like this, or I can have them do it overhead, where they're coming in this position, and they're not leaning way forward, but really keeping that more in an upright position. And at the end of the day, what we really want to make sure is that they're able to do this without shifting off to one side. So now you've seen the demonstration of that. The things that we want to watch for is we want to make sure that they don't have a lateral shift. If we do this squat neuromuscular retraining, I will say this, is when we do the squat neuromuscular retraining, if this is outside of pain and outside of a bony block, you should be able to correct a lateral shift in 2 to 3 visits. If they do their part, now we gave you a home exercise program or a home exercise that they can do to help reinforce this. If they work on that when they're sitting down in a chair, getting off the commode, getting on their bed, if they do their part and work on this, and we do this technique with them, you should be able to correct a lateral shift in 2 to 3 visits. 2 to 3 visits. If it's not corrected in 2 to 3 visits, 1 of 2 things is happening. Number 1, they're not doing their part. And number 2, we got to go back and we have to reevaluate the kinetic chain to find out what is the root cause that's causing this. Because in most instances, yes, they are going to, if let's say I'm shifting to my right, I'm having tightness on this side because I'm shortening this side, and I'm having decreased range of motion on this side. But in a full weight-bearing position, outside of pain or bony block, if you correct that lateral shift, you will correct the limitations in range of motion, and you will correct any tightnesses on the other side. Outside of even having to do stretches and things like that, body weight exercise, in my opinion, will be one of the best ways that you can correct that. So again, if you've not corrected that in 2 to 3 visits, we need to go back and evaluate the lower kinetic chain to find out, is there something else that's adding to this? Is there a meniscal tear, or is there a bony block somewhere, or is there pain in their hip, or something along those lines that is preventing them from correcting that? But most of the time it's 2 to 3 visits, and the 2 things that limit that is an undiagnosed differential diagnostics for the lower kinetic chain, or that the athlete is not doing their part. So again, going back, what are we watching for? We want to make sure that they correct their lateral shift. We don't want their heels off the floor. And believe it or not, this is one of the things that I find amazing, especially working with our younger athletes, is that a lot of athletes lose their balance when going through a squatting motion. That a lot of younger athletes, 14, 15 years old, that they've lost that ability to perform a full range motion squat. So again, if there is that chance that they might lose their balance, put a chair behind them so that they can fall back into a chair, but really getting them to move through that full range of motion, and eventually they should be able to do that. Also, we want to make sure that they don't have extensive trunk flexion or lumbosacral motion. So as we demonstrated with the CLX, with the squat neuromuscular retraining, there's also exercises that you can do for home program. The CLX squat that we demonstrated for you is designed to help improve or bring in and help correct that lateral shift. Now, the reason that we do the CLX squat is, as you can see in this photo and as you saw in the demonstration, is you bring in a lot of the upper kinetic chain in with that. With the way that we bring the CLX, the way that it crosses across the system, provides resistance, you're getting a lot of scapular input, you're getting a lot of core input, upper extremity input, plus the legs. And what did we say back on the neural slide? We said that one way to help correct this is to bring in multiple systems. And that's exactly what this does. And that's one of the things I like about the CLX, is because it allows us to use a band and use it so we can bring in multiple systems in multiple extremities. So again, it's one of the techniques that we use. What you want to make sure is, again, when they're doing this as part of their home exercise program, number one, you're going to know if they're doing it because they're going to demonstrate this for you. They're going to demonstrate this for you, and you want to make sure that they don't have a lateral shift, heels coming off the floor, they're not losing their balance, not getting excessive trunk flexion or lumbar motion. So they should be able to demonstrate that for you once you've given that as part of their home exercise program. We all know, we've all seen it. When you go and you ask somebody to demonstrate it for you and they have no idea what you're talking about, or they just completely do something that is completely wrong, they're not doing it. So it'll be a further indication of why maybe they're not correcting that lateral shift. So we also do this as a technique that we do with teams. So, one of the things that I've had a lot of therapists ask me, well, Trent, you start talking about perturbations, because this is what we're going to be talking about. We start talking about perturbations. That's really something that is really a skilled technique. It should be done by an athletic trainer or a physical therapist or somebody with a higher level of clinical reasoning. And quite honestly, that's not the case. Perturbations can be done by anybody. It is to make sure they're done properly, it should be done under our direction. So it's our responsibility to make sure that they are doing it correctly. So the demonstration that we're going to do is we're going to have two athletes doing the squat neuromuscular retraining and how we might do this in a team setting. So we'll have the athletes face towards one another. What they're going to do is they're going to perform 10 repetitions. On their 10th repetition, what they're going to do is get down into the squat position. They will give each other feedback on if they've got a lateral shift or not, helping them correct before they start. And then what they're going to do is they're going to give each other perturbations. And what they're doing is they're going to give each other perturbations to their shoulders, they're going to give it to their hips, they're going to give it to their arms, etc., really trying to disturb their system. And then what they're going to do is they're going to do 10 more reps, and then they're going to repeat that process. It's the same squat neuromuscular retraining that we do in the clinic, but now we can apply that same technique out in a team setting. Now, a couple of things I'll say. And unfortunately, you do have to say it. What I always say to all of our teams, no face shots. That quite honestly will start a fight, number one. And also no anterior posterior, because if you hit them in the chest or you hit them in the head, pushing backwards, most of the time they're just going to fall down. So obviously it's for a word of caution. So we're going to go ahead and go through that demonstration. So we've gone through the squat neuromuscular retraining. We've gone through the squat neuromuscular retraining CLX home exercise program that you can do. And now one of the things that we want to do is talk about the squat neuromuscular retraining that we can do as a part of our team concept. Now, when doing this with a team, number one, it's really important that we explain to the athletes what we're trying to do. We're not trying to break each other. We're trying to get each other to stabilize. At the same time, as the clinician, what we're doing is we're walking around the entire group. So you can do this with groups of 30 to 40 athletes all at one time, and they are helping each other be successful at this. So as I'm working with my partner, one of the things I want to make sure that my partner is not doing is allowing their knees to go in towards midline and that they're having a good squatting position. So when you do this, what you're going to do is basically you're going to do your 10 reps, and then we're going to give each other perturbations. The other thing that I will say with this particular exercise, it's very important that you're not hitting your opponent in the chest, giving them any kind of anterior, posterior directed force, because they'll just end up on their behind. The other thing is that there's no face shots. As much as that sounds like you don't need to say it, unfortunately, you just need to make sure that that is clear. The other thing is that it's important that the athletes understand, again, that you're not trying to break the other athlete. You're just trying to get them to respond. And finally, the other thing I'll say is that one of the things that this does do is every single time that we do this in group with multiple athletes have fun with it. And that is important because they are helping each other be successful at it, and they actually enjoy the experience. Okay, so what we're going to do is we're going to demonstrate 5 repetitions. Typically, we will do 10 to 15 to 20 repetitions. So we're going to do 5 reps. We're going to do perturbations until I say stop. We'll do 5 more reps, and then we'll do 10 perturbations. Okay, are you ready? Go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. I said 5, but we did 10. That's all right. Just like go, 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 fast, 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 go, 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 fast, fast, fast. 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Go, 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 go. Good. Okay, so that is the squat neuromuscular retraining that you do in partners. Good job. All right, so some of the clinical things that we can walk away with the squat. Now, this course is not intended to be a heavy manual course. We are going to, during the demonstrations, you've seen us go through some manual things and describe some different techniques that we can use, but this is not a super heavy manual course. That being said, what I'm going to recommend is that there are some things that we can do from a manual perspective to help with things that we might see. For example, a lot of times we'll see those athletes who are really tight through their lower quarter. And when I say lower quarter, that really starts in this area and kind of down through their quads and their hamstrings. And those individuals, when they do a squat, you may see a lot of hypomobility, so a lack of mobility of the lumbar spine. Lumbar spine does have to have some flexion, especially towards the end range of motion of a squat, to allow the sacrum and the pelvis to kind of tuck down a little bit. And if they don't have that, there are techniques that we can do on the table to help improve that. If we find that they don't have a good range of motion, again, these are things that we can all identify with the squatting motion that we can work on. Whether it's contract relax techniques that we do with some Thomas test or some sideline stretches. What I always do is any technique that I do on the table, if I'm seeing a limitation, hypomobility with exercise, if I'm seeing a hypomobility with a squatting motion, remember, this is all movement-driven intervention. If I'm seeing this limitation that's occurring during their squats, what I'm going to do is I'm going to put them on the table and I'm going to do my manual techniques. But what I'm going to follow that up with is immediately having them get back into the motion. Because at the end of the day, if my manual techniques do what I think that they do, and they do what I say they're going to do, I should see that impact their actual movement. So what I do is I'll have the athletes, say we're having them do squats, I'll have them do the squat, I'm seeing a limitation, I'll put them on the table, I'll do my manual techniques, put them back in the squat, and say, doesn't make a difference. Watch, doesn't make a difference. Because then what I'm going to do is I'm going to have them work on the exercise with that new range of motion. Because what did we say before? Full weight bearing body weight activities like this should help us maintain those ranges of motion. Those soft tissue limitations should be gained under under body weight types of conditions. So once we gain it on the table, we should be able to maintain it by continuing to push that proper exercise in that proper form. So some other techniques that we can use is for those clinics that have sleds. This is a really good exercise. What we'll do is we'll have them down in a bilateral squat. So just like in this picture, we'll have them in a bilateral squat and have a pulley on the sled. So what they're going to do is in the squatted position, holding their core nice and tight, they're going to pull with one arm and then grab, come back, squat, pull with the other arm. So that way they're constantly pulling diagonal across and at the same time creating that strong, stable core while down in a squatted position. Again, part of the reason that we're doing that is to bring in all of the systems into the equation to give them a sense of where that's at. Now, this is a more advanced technique, so we want to make sure that at this point, they do not have a lateral shift, and we're just reinforcing where that should be by bringing in multiple systems. Another way that we can do that is with the overhead squat. So for some of our power lifters or our CrossFitters, the overhead squat is obviously something that they want to get back to. This is not a shoulder course, so we're not going to get into some of the shoulder things that go along with that, but for those athletes that want to get to an overhead squat, that's another technique that we can do. And again, makes it really challenging to make sure that they don't have a lateral shift during that. Another technique that we can deploy is we can have them do squat hops. So this is an exercise where we'll have them do 10 squats, hop forward, 10 squats, hop forward, and have them do that for 20 yards. Now, let's refresh on what our goal is. Because before, in an earlier presentation, we talked about not just doing exercise to do exercise. We're not doing exercise just to make it tougher or to be as creative as we want or to try to make the most complex things that we want. What we want is we want proper movement. So if I'm taking that athlete, for example, on squat hops, and I'm having them do 10 squats and then hop forward, and their knees are going into a valgus position every time I do that, stop. Repetitions to substitution. We talked about that concept earlier. Repetitions to substitution. That's the point where I'm stopping. And why is that? We're going to go back to the neuro side. Because all we're simply doing is reinforcing that bad movement pattern. So in that case, what I might do then is go to a lower form of the exercise. So maybe I try 5 squats and a hop. If they still can't do it, maybe I just try a hop. So there's ways of regressing the exercise, but still training them. Still training them to maintain or improve their endurance and tap into that fatigue state without reinforcing those bad movement patterns. So we've all been doing this for a long time, so we know there's a lot of different techniques to regress an exercise, but keeping in mind that the number one thing is to keep in mind is that we do not want to reinforce those bad movement patterns.